Oral Hygiene Care Plan. The Oral Hygiene Care Plan is a tool that can be used to outline what a resident will need to ensure they are receiving adequate and appropriate oral care on a daily basis. This care plan should be reviewed and updated each time an oral health assessment is completed. The purpose of the tool is to identify in detail what helps and hinders mouth care that will lead to a healthy mouth. It provides a way for staff to communicate about the oral care of individual residents and can also provide a record of whether or not progress is being made over time. Let's review this tool. It is important to fill in the resident's name, date, and who completed the care plan. If they have a dentist, include their name and phone number for easy referral. The date of the resident's last dental appointment and the date for their next oral hygiene assessment and treatment can also be recorded here. Even though this plan is meant to follow the more comprehensive assessment provided by the Oral Health Assessment tool, a few details about the resident's oral situation are recorded here as well. For example, the first block is for the assessment of dentures. Circle whether the resident has upper or lower dentures or both. Indicate whether they are full or partial dentures. If the resident does not have any dentures, this should also be noted here. Record if the dentures are labeled or not. To the right of this section, record whether or not a resident is able to look after their own denture care, or what level of assistance may be required. Some residents are independent and able to look after their own dentures, while others may require some assistance or be fully dependent on others to provide their denture care. Looking to the section on natural teeth, here we indicate whether the resident has any natural teeth in either the upper or lower arch. There is also an opportunity to record whether there are root tips present in either arch. When the crown of a tooth breaks off at the gum line, the part of the tooth that remains in the arch is a root or root tip. These are often stable in older adults and not a cause for concern. However, they can become infected and need to be monitored carefully. Again, to the right of this section is a place to record whether the resident does their own oral care or whether they require some level of assistance. The bottom half of this form provides a space to record details and tips for providing daily mouth care. On the left, a variety of common oral hygiene interventions are itemized to cue the care provider about best approaches for a particular resident. For example, it may be indicated that an electric toothbrush should be used at least once a day. Or it may alert the care provider to a prescription for fluoride or various products to alleviate dry mouth. On the right is a list of regular barriers to oral care. The itemized list helps to identify behaviors that might be expected of a particular resident, such as won't open mouth or can't swallow properly. These are noted in order to better prepare the care provider to provide daily mouth care. For example, if someone cannot rinse or spit, it would not be appropriate to provide them with a fluoride mouth rinse. It may also alert a care provider that they need to have a low-volume suction machine when providing oral hygiene care. It would be appropriate for the care provider to have a low-volume suction machine when providing daily mouth care to that resident. At the bottom of both sections is an opportunity to add other notations if required.